Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health, Seniors, and Long-Term Care. Questioning for the department will proceed in a global manner. The floor is now open for questions. Honorable Member for Robland.
Thank you, Honorable Chairperson. I'd like to start with pathology. I'm wondering how many pathology vacancies we have within shared health and what current wait times are for pathology results.
Thank you, Member. Honorable Minister.
Sure, Chair, just seeking your clarification, your guidance here in terms of the 25-26 estimates and questions being about the 25-26 estimates. Just wondering if you can offer any guidance in terms of the questioning.
Thanks for the question, Honorable Minister. So the estimates talk about the staffing and vacancies. So questions about staffing and vacancies are relevant to the estimates. Honorable Minister.
Thank you so much for your guidance, Chair. I appreciate that.
Honorable Minister.
Honorable Chair, just seeking a bit more clarification here. So understanding that your guidance is correct here in terms of staffing and the budget, but just wondering, our budget prints staffing lines and funding globally, and so specific staffing lines that are in regional health authorities aren't directly funded by government. The estimates provide global funding to regional health authorities. So I'm just wondering if you can help maybe provide a bit of clarity here as to whether or not, based on the way that the 25, 26, and typically the budgets are assembled and structured, whether or not that particular question makes sense given the structure of the estimates and the way that we fund globally for health.
Once again, thank you, Minister, for your question. As advised, supplement to the estimates of expenditure do talk about staffing and wait times. So I think the question is still relevant.
Thank you, Chair.
Honorable Minister.
Thank you, Chair, for your guidance.
Honorable Minister.
Thank you so much, Chair. I just want to take a moment, as it is Allied Health Care Professionals Week, and we had a good group of folks who joined us here at the legislature today for a ministerial statement recognizing allied healthcare professionals. I want to take a moment while we're in committee to recognize all of the allied healthcare professionals across the province who do incredible work in our healthcare system each and every day. There are allied healthcare professionals in my own family who do really amazing work. And, we've all, if you've accessed healthcare in Manitoba, you've likely benefited in some way, shape, or form from an allied healthcare professional. So I want to thank these folks. I want to thank everyone who joined us today, who contributed to helping us celebrate today. And I want to acknowledge that we've been working with some really wonderful allied healthcare experts in the province who have been helping to guide our approach and inform our approach. We have really wonderful folks here in the province who have been working and leading in this space for a long time, who were eager to partner with government to help make the right decisions in terms of how we approach strengthening healthcare, fixing the damage, but also strengthening healthcare long term. And we know that this takes time, takes a significant amount of time to repair that kind of harm to the healthcare system. But these folks are fully committed to putting in the time and the energy required to move things in the right direction. And so I want to thank them for their expertise and for also helping inform our approach with the Retention and Recruitment Office. So our decision in the 25-26 budget to have a dedicated role, an allied healthcare professional role with the Retention and Recruitment Office was based on feedback we heard directly from, you guessed it, allied healthcare professionals. And we're confident that this person, bringing that lens to the Retention and Recruitment Office is going to be a real asset and is going to really help us take further necessary steps to make sure that we're retaining the folks that we have in Manitoba, we're training even more, and we're successfully recruiting folks to the province. And so, not only this week, but I would encourage Manitobans as they move forward every week to reach out and thank allied healthcare workers. It's over 7,000 here in our own province across hundreds of disciplines doing really critical work, and we can't thank them enough.
Thank you, Minister. Honorable Member for Roblin.
Thank you, Honorable Chairperson. I would just like to remind the Minister that they have the opportunity to take the question under advisement. If they don't know how many pathologist vacancies there are, if they don't know what pathology wait times are, they're welcome to take it under advisement and get that answer back to me at a later time rather than trying to dodge the question. The reason I brought the question up is somebody close to me is going through cancer right now, and unfortunately, she was waiting for her pathology results before she could find out whether she had cancer and what her treatment plan was going to be. So, she had an appointment, a follow-up appointment at Cancer Care scheduled on a Friday. The Thursday before, she got an appointment saying, oh, your pathology's not back, we're going to bump you a week. The next week, she got another call from Cancer Care saying, we don't have your pathology results back. Sorry, you're going to have to wait another week. The third week, she got another call on Thursday from Cancer Care saying, we don't have your pathology results back. We're going to have to wait another week. And so this person had to advocate for themselves through patient relations quite strongly in order to push for a verbal report on their pathology results. And that's why I'm certain that this isn't the only person that this is happening to. So I'm also certain that some briefing note must have crossed the minister's desk that the Healthcare Recruitment and Retention Office must have some awareness of the level of pathology vacancies in the province. And I'm just wondering if the minister could address the question, how many pathology vacancies do we have and what are pathology wait times right now?
Thank you, Member. Honorable Minister.
I think the critic for sharing that personal story. Certainly, I wish the person in her life who's navigating this difficult reality of cancer diagnosis and journey, wish them all the best. And, certainly our government takes this area and all areas of healthcare very seriously. We want for Manitobans to have a really seamless step-by-step experience. And certainly Cancer Care is a highly renowned organization. They've got a great reputation, but that doesn't mean that every single journey is without some experiences that we need to improve on. And so I would really encourage the critic, I've encouraged her to do this previously, to bring that kind of concern or casework directly to my office. We will always act quickly. We will always look into a matter very quickly and ensure that we get clarity to a person as quickly as we possibly can. There have been issues that other MLAs, including PC MLAs, have brought to my office or brought to me directly on the floor of the House or sent me a text message and have asked me to look into it. And I've done so very quickly and gotten them responses, recognizing that we're all here because we represent Manitobans and we want for folks to have the best outcomes possible. So I welcome the critic bringing that information to my office as casework to see how we can look into this very quickly and make sure that this is addressed. And I would say that concerns around any delays, whether it's pathology or anything else, should always be brought forward. We want to make sure that the system is working in the best way possible. And there are some areas where we found when issues have been brought forward that there's a delay, that it could be some sort of a misstep or an error that can be quickly addressed. And we really want the opportunity to be able to address those either missteps or errors when they happen and make sure that they're rectified so they don't occur moving forward. Other times, perhaps it's a procedural or policy improvement that actually needs to be made, and we're happy to look at that and take those steps as well. Other times, perhaps it's additional resource that's needed, and we've been very clear that our government is going to continue to invest where we need to make sure that there's enough healthcare human resource and capacity to improve services. And so it really helps when folks can bring those concerns directly to me. I know that in the past I've shared my direct contact with the critic. I'm happy to share it again offline, not in this committee, obviously, but offline if she would like to have it again, to make sure that if there's an urgent concern, she can get it to me really quickly. But we'll take that away as casework if she wants and make sure we follow up right away. What I would say is that Cancer Care has done a lot of work over the years that they've existed, but certainly more recently, I had the opportunity actually to attend one of their board meetings, and I was surprised to learn that that was the first time in their memory that a health minister had ever attended a Cancer Care board meeting. I thought that was a bit surprising. I was really happy to be there, however, and connect with the entire board. These are people, these are Manitobans who care so much for their communities, for our communities. These are people who dedicate their expertise to doing whatever they can to improve cancer care services. And I know that they would also want to be aware if there are any challenges on the pathology side, and make sure that we're all working together to address it. This is an area for us, as other areas of healthcare, where we know it's time sensitive and time dependent, and we want to ensure we're doing everything we can to get Manitobans those reports and tests and feedback as quickly as possible.
Thank you, Minister. Honorable Member for Roblin.
Thank you, Honorable Chairperson. I think part of the issue here is that I don't think, and I don't think that Manitobans think that they should have to go directly to the health minister whenever there's a problem, that the only way to get their issues addressed is through the direct intervention of the health minister. That doesn't make any sense. In the particular case that I've referenced, the individual learned that their pathology sample had been sent out of the city of Winnipeg. I'm not sure where it was sent to, but to me that points to a systemic capacity issue, and I don't think that that's an isolated case. I don't think that me bringing this here to committee today is going to be the first time the minister has heard that we might have a pathology capacity issue in the province of Manitoba. So I'm just going to once again state the question. Can the minister please indicate how many pathology vacancies there are in shared health and what pathology wait times are currently?
Thank you, Member. Honorable Minister.
Thank you, Chair. While we continue to look for more information, I do think it's important to speak to something the critics stated. Again, I welcome Manitobans to bring concerns forward to me. I think that's really important. I think it's important to be a health minister and to have a health team that wants Manitobans to reach out should they have concerns or ideas or experiences that they think would be valuable for us to know, so that maybe not only can we address their concerns in the moment and support families or individuals as they need, but so we can also take the necessary steps to improve the system. I'm not sure the resistance on this particular item from the member, to me, it might be indicative of the previous PC government's approach to healthcare, where they didn't want people reaching out, where they didn't want to hear from Manitobans. I've been very clear that whether it's positive feedback or criticism or concerns or ideas or experiences that are positive or challenging, whatever it is, we want to hear that feedback from Manitobans. We want to know from, an everyday Manitobans in any part of this province's experience on the front lines, what that's like for them. And I want for folks to feel comfortable bringing that forward to me as the minister. I want to thank folks who, I see people every day in our communities, be it at the grocery store, be it at sporting events, be it at the park, in the neighborhood, all kinds of circumstances where people will approach me and share their healthcare experiences or ideas or thoughts, and I appreciate that. I want to be someone who is approachable to their fellow Manitobans about healthcare. I think that's important, especially after 7.5 years of the opposite approach that did a lot of harm. And so again, I'll just say that if there are concerns that the member has or specific issues, she's always welcome to bring that forward as casework. I will always endeavor to address that very quickly and get her clarity on that, and make sure that the folks who are bringing those concerns forward, first and foremost, that they have the information that they need in order to move forward. I will say that, of course, when folks are advocating, that can be very challenging. I want to commend this person. Despite a very challenging experience, sounds like they did advocate, they went to patient relations and brought their concerns forward and got a response. We definitely want to see that process and that experience improved. We want for folks to have improved access to the information that they need. So that's information that is good for me to hear, for us to hear, and for us to take away. And I'm hoping that the critic will be willing to provide more information so we can take a closer look at that situation and ensure that the process is improved for other folks as well. And again, I want to share that I hope this person's journey is seamless moving forward, and if they do have any concerns that we can help with, that I can help with, I'm happy to do so. The member also talked about capacity challenges in the healthcare system. I think it's really important for us to be clear. There are capacity challenges in the healthcare system. We've never shied away from saying that. There are very real capacity challenges in healthcare. That is what happens when you cut capacity in the healthcare system for 7.5 years. That is what happens when you fire the people who have that capacity, when you don't train people to have more capacity, when you close the infrastructure and cut the infrastructure that houses all of the human resource capacity that our growing population and increasingly complex healthcare needs population should be able to access. And so we are doing the work of adding more capacity to the healthcare system. Like all Manitobans, we wish that work we're able to advance even more quickly than it is, but we're doing this in a sustainable way. We are working as quickly as we can, and we're doing it in partnership with folks in Manitoba who understand healthcare. A good example of that would be the fact that our government has money in the 25-26 budget for a new cancer care headquarters. I bumped into a friend, actually on the weekend, who is 1 year younger than I am. She's wonderful. We used to work together in youth mental health services. She's just fantastic and has had a really difficult cancer journey herself. And she's now in remission. I'm thrilled. I was happy to see her coming from an appointment and looking great. But that's someone who, when I shared with her that we do, in fact, in our budget have dollars aside to get that cancer care headquarters going, she was really happy to hear that, because she shared with me in that moment some improvements she would like to see to these services based on her lived experience. And I thanked her for taking a moment to share that with me. I think that's really brave of her to do so. And I want to make sure that we're doing our part to move cancer care to a great institution, but let's make it even better. Let's serve Manitobans in an even better way. And that's the work our government is committed to doing. So, in terms of pathology, certainly if there are concerns
Minister's
there.
time is expired. Honorable Member for Roblin.
Thank you, Honorable Chairperson. On page 42 of the supplement, one of the performance measures that's discussed is the child mortality rate. And I just noticed that it's tracked for 2022-23 and it's tracked for 23-24, but it's not tracked for 2024-25, and there's no target listed under 2025-26. Which I can only assume is an oversight, because I think a deliberate decision to stop tracking that number would be troubling. So I wonder if the minister could indicate what the infant mortality rate was in 2024-25 and what the target for this performance measure, this very important performance measure, is in this fiscal year.
Thank you, Member. Honorable Minister.
Thank you, Chair. Hoping to get some information on the pathology question, but in the meantime, I would like to talk, and we'll get some more information on this one as well, but in the meantime, I would like to talk a bit about the fact that our government has made very clear that we want to see more children reach their 18th birthday. This is a really, to some folks, perhaps that seems like an obvious statement, or, why would a government make that statement? But we make that statement as a government. We want to see more Manitoba children reach their 18th birthday. Because as a government, we see that as a guiding light, I suppose, something for all of us as Manitobans to unify around. I think it's fair to say that all Manitobans would see that statement as an important and valuable statement, that we should be doing what we can to ensure that more children reach their 18th birthday. And really fundamentally what that is saying is that we want all kids to live healthy, productive, safe, dignified lives. Something that our government was able to do very quickly in our mandate speaks to that. Healthcare isn't just about hospitals and services. Healthcare, people know, likely in this room and elsewhere, that the social determinants of health is a big part of this conversation. We really are taking an all-of-government approach to healthcare. And so when we talk about healthcare and improving the healthcare outcomes of children, we have to talk about things like education And I hope the chair will allow me to talk a bit about investments made not out of the health portfolio, but under the education portfolio, and our government's investment of over $30 million to establish a universal nutrition program, a food program for kids in schools. That's a healthcare investment. That is an investment that takes those words, we want more kids to reach their 18th birthday, and puts it into real action. Making sure that kids can go to school and focus on their studies, focus on learning and having fun with their friends, and developing really important life skills versus sitting and having an empty tummy and not being able to focus. That's a big difference maker. That's an equity gap closer. That's an effort that, as a province, we should be really proud of. And I know that when I talk to Manitobans, no matter what professional field they're in, educators or healthcare workers or business people, everyone's on the same page that that's the right investment to make. And so that's certainly a concrete, tangible step that our government has taken to support that outcome, that improvement around that outcome. There are other steps, though, our government has taken to improve infant mortality. It was stated earlier in the House today that the previous government cut women's health care. A good example would be cutting lactation consultants. We've taken a completely different approach. We know that it is so important that women and those who have families have the tools and the resources and supports that they need to have healthy outcomes. And so our government did something rooted in evidence, rooted in science. There was about a 20-year study that was done. Because when the prenatal benefit was introduced, I believe in 2001, quickly after, years after, it was seen to make improvements, to improve the health outcomes of not only children, but also families and parents, mothers. And after 20 years, that investment, that approach was studied, and the evidence is plain as day that the prenatal benefit improves the outcomes for babies, for children, for families, for women, for parents. And so our government, looking at that evidence, made the decision to double the prenatal benefit. It's another tangible step, action that we took to support more children seeing and thriving to and beyond their 18th birthday. We know that there's much more work to do, but there are real steps that a government can take, steps that a government should have taken years ago, but we're taking now to move the outcomes for babies and for families in the right direction. Hoping to provide a bit more information on the question the member's asking, but I wanted to provide that context for the committee. I thought it was important.
Thank you, Minister. Honorable Member for Lakeside.
Thank you, Honorable Chair, and I just want to switch it a bit over to seniors and long-term care here. The budget for seniors and long-term care has remained frozen at $19.6 million for 2 consecutive fiscal years here now, after a dramatic reduction from $93 million. Given the growing seniors population and increasing care needs, this is somewhat concerning. Why has the budget for seniors and long-term care remained stagnant at $19.6 million for 2 years, and how does the department justify this significant reduction from $93 million despite rising demand and system pressures?
Thank you, Member. Honorable Minister.
Thank you, Chair. I do want to go back to the critic's question around infant mortality and just share a bit more. There's a bit more information I'm waiting for that, but I want to talk about that a bit before I get to the member's question on seniors and the line in the budget, which is actually pretty straightforward in terms of. I think we actually addressed this in estimates for 24-25 rather. I think that came up, but in terms of infant mortality, our government has been working with various partners, CPSM, College of Physicians and Surgeons of Manitoba being one of them, to look at ways that we can do better work, more work in this space, and work with our experts locally to improve the infant mortality rates, which we know in Manitoba have been disproportionately not where they should be for quite some time, and we have to do better. And so there are policies that we're looking at in terms of, how do we keep infants safe? How do we work with families to make sure they have the education, awareness, information, and the support and services to make the most informed healthcare decisions for their little ones? I would say also including vaccinations. We've been talking a lot about that lately. I want to take this moment to encourage people to get vaccinated. Certainly when it comes to measles, we're seeing measles unfortunately make a concerning comeback and having really, really terrible consequences as a result. And so when we're talking about infant mortality, when we're talking about improving the outcomes for children, we really need to talk about some of these, what were fundamental principles that were understood, right? Vaccinations are good, improves outcomes, vaccinations are safe and effective, and now we're in this space of having to have these conversations again. I think part of it is generationally, so many of us, including myself, have benefited from vaccines that we haven't thankfully had that experience of what it's like to not have access to vaccines and seeing the really tragic outcomes of that. And so it's really important for us to engage in that conversation in a productive, safe, and informed way. I had the opportunity recently to meet with an incredible physician scientist, expert pediatrician, Dr. Holtz, who is a world leader, a renowned scientist who has led the way for remarkable vaccine development. Just a really incredible human being with a heart for keeping people safe and healthy. And was able to chat with him and learn a bit from his expertise and his perspective in terms of what can we do in Manitoba? What can we do in Manitoba to make sure that communities have as much information as possible to make informed health decisions and to mitigate that misinformation and disinformation around vaccines, which is incredibly harmful. And we're seeing how destructive that disinformation and misinformation is. So certainly governments have an important role to play, and we take that very, very seriously. I will say that some of the information I'm looking to clarify here in terms of what happened with the infant mortality data that the critic asked about, what we're seeing, and I'm going to get clarity on this, but it appears as though the approach on that was disrupted by the previous government in transformation, which is very, very concerning. And I'm going to get more clarity on those details. But certainly our government is doing the work of making sure that that information is available. In terms of it not being printed in the budget, that may have just been a miss. It should have been in the budget, but I think there was a bit of an error there perhaps. But what I am really concerned about is that it may appear as though the previous government made some changes in terms of how the approach to doing the work around infant mortality was happening. But I'm going to get more clarity on that shortly. So I hope that provides a bit more information in terms of infant mortality here in Manitoba and the work our government is doing, knowing there's more that needs to be done. And we are going to get some clarity as well for the critic in terms of the numbers and the data. And in terms of who sets those targets, the CPSM, great folks there, wonderful experts, really are the leaders in this work in the province. And they provide the province guidance, and they really set targets around what we should be looking to achieve and how we can get there. And I'll speak to the other member's question about seniors shortly.
Thank you, Minister. Member for Lakeside.
Thank you, Honorable Chair. Seniors in long-term care is seeing its staff drop from 15 full-time equivalents in 23-24 to 8 full-time equivalents in 24-25 to 7 in this year's budget. So, just to ask the minister, if the seniors are of such great importance to the minister, and I'm not by any way suggesting that they aren't, why has there been a consistent reduction in the staff?
Thank you, member. Honorable Minister.
Yeah, I thank the member for that question, and I appreciate the member's approach in that question. I think he knows that I do value seniors. Our government certainly does. I think my first, unless that's so long ago now, I may be mixing it up, was it Victoria General Hospital that I first volunteered or the seniors home in St. Norbert that I first volunteered? I'm not sure. But one of my early forays into healthcare was at a seniors home in St. Norbert, which was an absolutely joyful experience. I had never really spent that kind of time around seniors. Grew up not having any actual grandparents in Manitoba. And so it was really a delight to go and visit seniors regularly and learn how to play card games and bridge and things like that and hear their stories right in my own community, right in my own neighborhood. And it really influenced the way that I think about seniors care and personal care homes, how I thought about it moving forward. So to be in this role and certainly having that experience and others in healthcare working in long-term care settings, and knowing and listening to folks who provide care in long-term care settings, we take that very seriously. And also just, we all have seniors in our lives who we love in our communities. We want our communities to be a place people can age with dignity, age well, age in place if they choose. I say we all have seniors in our lives. Perhaps we're seniors in this room. I don't know. I don't know people's ages off the top of my head, but we want all seniors, no matter where you are, what roles you have, to have the best lives possible. And the ways that we do that are investing. And again, it's across government we take this approach, whether it's housing, affordability, healthcare, education, jobs, economy. We want to make sure that seniors can thrive in Manitoba. And so to answer the member's question, if you actually hold up the two budgets, so 24-25, 25-26, you can actually see kind of spells out there underneath the seniors information, maybe what happened there and answers the member's question. But the structure changed, right? So the Department of Seniors shifted. It's now Health, Seniors, and Long-Term Care. And so the staffing associated with the previous department are what folded into Health, Seniors, and Long-Term Care. So that speaks to the FTE change that the member's asking about specifically. In terms of the funding difference, I want to reassure the member that we're only investing more dollars in seniors care. So specifically in terms of long-term care, almost an additional $150 million is going into long-term care and personal care homes. And in terms of home care, we're looking at an increase of about 90, I think it's 87.3 million dollars for home care. So we're investing more money into services and care for seniors in this province. Those are two specific buckets. There are additional dollars in other areas as well that we're investing. And I think the member is well aware of the establishment of the Independent Office for the Seniors Advocate. So that is something that seniors have been asking for years and years. I know the member is well aware of that. It is something that our government committed to delivering for seniors, and we've done that. We brought forward legislation to enact that and enable that. We made sure that there were resources in the budget to support the office being established. And I get questions from folks all the time. I'm not sure if the member does, from his constituents about how we're moving that along. And I have to remind people, I have to even remind myself in the beginning that it's an independent office. And so that work is underway. It is happening. There's a whole process. And if folks want to contribute their voice or have concerns, they can go to Engage MB and they can actually share their thoughts on what they'd like the Independent Office for the Seniors Advocate to look at. There are some wonderful advocates in our communities who I've sat down with who have chatted about their thoughts on what it could look like, and I've encouraged them to bring that forward. It's a long-form submission. You can go there and you can just, there's no cap on what you can share in terms of what your thoughts are and what you'd like to see. So those are a few key areas. I hope that addresses the member's question, but I want to reassure him that there's more investments going there, not less, and that the FTE change is just related to a change in the structure.
Thank you, Minister. Honorable Member for Lakeside.
Thank you, Honorable Chair, and I want to thank the Minister for that answer. I just want to clarify if I'm understanding it right, that as the SLTC has been subsumed by the Greater Department of Health, if I'm understanding what her answer, that some of the tasks were previously the responsibility of the SLTC are now being carried out by the health staff in one of the other main appropriation areas, and that might not be accounted for the 7 full-time equivalents attributed to the seniors in long-term care. So how many FTEs are there doing SLTC work from other appropriation areas, for example, public health or performance and oversight?
Thank you, Member. Honorable Minister.
Thank you, Chair. I'm hoping for some clarity here. Is the member asking about what are the FTEs associated with seniors in long-term care and also public health, or just seniors in long-term care? Because he added public health at the end, and I'm not sure if he's wanting both or, yeah.
Thank you, Minister. Honorable Member for Lakeside.
No, my question to the Minister, Honorable Chair, was just clarification on the previous question as to the appropriation of staff and where the one full-time equivalent went. I'm assuming in her answer that full-time equivalent went.
Order, please. I would like to remind the members to use proper pronouns for their respectable members in the committee. Honorable Member for Lakeside.
Thank you, Honorable Chair, and I apologize for that. So the one full-time equivalent is now taken over by the overall Department of Health is what, I just wanted clarification on if that's what.
Thank you, Member. Honorable Minister.
Thank you, Chair. I'm happy to answer the question for the member. So if I'm correct, the one FTE that he's referring to was established in relation to the Stevenson initiatives in 21-22, created in 2022, and it was approved for a 3-year term only. And so Treasury Board, these roles get approved at Treasury Board. Treasury Board approved it for 3 years. It automatically then gets, I guess you could say, rescinded or removed once that approval window is up by Treasury Board. It's an automatic process. That being said, the position that was created in 2022 was actually never filled. So under the previous administration, that role was never filled. It was actually vacant. And so even though it's an automatic process, it would have been pulled back anyway. There was nobody in that role.
Thank you, Minister. Honorable Member for Lakeside.
Thank you, Honorable Chair, and thank you, Minister, for the answer to that question. It clarifies a little bit. The Stevenson Review offered critical guidance on improving long-term care standards and outcomes. Can the Minister provide a detailed update on how far along the department is in implementing the Stevenson's report recommendations, and specifically how many recommendations remain to be implemented?
Thank you, Member. Honorable Minister.
Thank you, Chair. The Stevenson recommendations, happy to provide an update to the member on that. I do think it's important for us to reflect on where those recommendations come from. I think folks will remember that during the pandemic, COVID pandemic, there was a really tragic situation at Maples Personal Care Home. Some folks posted on Reddit, I believe it was paramedics who posted on Reddit, that what they were seeing happen at Maples PCH was horrifying. And what we learned after the fact was that Maples Personal Care Home had actually reached out to the previous PC government and asked for help, and they hadn't received any. The response when this became very public was fairly swift, but the damage and the tragedy had already occurred. We saw a massive loss of life and families forever impacted by a failed approach by the previous administration in terms of keeping seniors safe. So the Stevenson report was a direct result. It came out of that, right? It came out of a real tragedy where Manitoba families were reeling and dealing with an unacceptable situation that I know still affects people to this day. I remain in contact with some families who are still affected by that circumstance to this day. The recommendations, I believe there were 17 recommendations, 16 or 17 recommendations. I am able to share with the member that the recommendations have been actioned. All of the recommendations have been actioned and followed through on. The one outstanding recommendation that is ongoing is the hours per resident per day. So that target of 4.1, that work is still happening. Our government did cement an additional $40 million in our 25-26 budget to support that, which is as you can imagine, a massive investment in terms of staffing, but it's a necessary investment for personal care home staffing. And that's in our 25-26 budget, the $40 million for that staffing initiative. Much more work to do. Our government has also taken steps. I was actually just this morning at the Long-Term Continuing Care Association conference that's happening. So they're at the Victoria Inn. And I was really happy to go there this morning, bright and early, to meet with all of those folks and offer our government's greetings and just say thank you. Thank all of those folks across many different disciplines and areas of the province and actually other jurisdictions who've come together to do the work of strengthening long-term and continuing care. And interestingly enough, one of the allied healthcare professionals who was at that conference this morning was also in the gallery this afternoon as we recognized allied healthcare professionals. It goes to show you how small our city and province is and how connected we all are. And so the work is being done in our 25-26 budget. I think the member can see that we're making real investments in strengthening care for seniors. The structure in terms of how that's delivered has changed, from what it looked like under the previous government. We've got health, seniors, and long-term care as one department. We are delivering on key items for Manitobans as a result of that. So we have, again, independent office for the seniors advocate being stood up. We have increased funding for long-term care and home care. We have increased funding for services in community. We have increased dollars that are going to wonderful organizations like the Alzheimer's Society of Manitoba, who do just phenomenal work and are really great partners. So, and we're building personal care homes. I can't believe I forgot to mention that. We're building new personal care homes in Manitoba. And we've actually reopened 45% of the personal care home beds that were closed under the previous administration. So all of that to say, there's still so much more work to do to make sure the needs of seniors in this province are meaningfully and adequately addressed. And we know that. So we're going to keep working with our partners, and we're going to make sure that beyond this budget, 26-27, we're already looking at that budget and planning and seeing what else we need to do to make sure we're moving things in the right direction.
Thank you, Minister. Member for Lakeside.
Thank you, Honorable Chair. And yes, thank you for the answer, the Minister. The senior strategy, you did receive lots of praise and positive reception across the province, and it was a groundbreaking document aimed at improving quality of life and access to services for older Manitobans. Now, where specifically in the 25-26 budget can funding for the implementation of the seniors strategy be found? And what is the total amount allocated towards that initiative?
Thank you, member. Honorable Minister.
Thank you, Honorable Chair. I apologize to the member. I am going to go back just because I have a bit more clarity on a question that was brought forward by the critic, and then I'll return to your question about seniors, if that's all right. I just want to make sure that I cover that off. So as I mentioned earlier, the critic asked a question about infant mortality and asked about maybe there's an error in terms of it not being printed in the budget. And we have gotten clarity in terms of what's happened there. And unfortunately, what's become very clear is that the estimates reports for 23 and 24, so the last reported statistics, the data for infant mortality was provided, but concluded through transformation. The previous PC government actually cut the funding for the CPSM to do that work and report on infant mortality. So unfortunately, in their last ever budget in government, the previous government chose to cut the funding for the CPSM, who does the work of bringing forward targets that we should be looking to achieve in terms of infant mortality and in terms of doing the work around infant mortality, which is very concerning. And so that is why it's reported that way. I also want to highlight that the indicator, the information is lagging, so it's lagging by a year, I believe, and the CPSM gathers that information. It's lagging information, though. This takes a lot of time and effort to compile that information. The CPSM does a tremendous amount of work to compile and finalize and then validate and then report the information. And so the information for 24, 25 will be reported in the 26, 27 year. Again, it's a year lag. Now, it is obviously concerning that the previous government would have cut the funding for this effort. I think that everyone can agree that that's not the right approach. I do want to let folks know that our government has been working directly with the CPSM. We've been engaged in conversation with them for some time in order to reestablish the committee. So previously it was the Child Death Review Committee that did that work. Our government is doing the work to establish a committee with the CPSM and partners, and to make sure that the committee is fulsome and representative in a way that will allow for us to actually get even greater data, enhanced data in terms of how we do this work. So that we recognize it's very, very important. We look forward to the partnership with CPSM to do this work. It's unfortunate that the decision was made by the previous government to cut those efforts, but we take it very seriously, and so we are going to reinstate it and make it even better than it was previously. And I want to thank our partners for being willing to work with us on that front. We are also engaged in many other conversations with the CPSM in this area, recognizing that we want to make sure we take a culturally appropriate, sensitive, and informed approach in terms of how we do this work in our province. And ultimately, the work the committee did previously before it was cut by the previous government was invaluable, and the work that we are going to reinstate and do with this committee, in addition to the work our government has been doing, really just speaks to, what our North Star goal, and I think the North Star goal for all Manitobans is, and that is for more children to see their 18th birthday and to live healthy, happy, productive lives. To the member's question, now just pivoting away from that, to the member's question about seniors, I wanted to also offer to the member that, our government has taken a different approach in terms of how we address the needs of seniors. I neglected to mention previously that we are establishing the Healthy Aging Council here in Manitoba, which is bringing together a group of diverse seniors to have their voices heard and help advise myself and our government in terms of senior issues. Looking forward to sharing more details on that. We also do have the Healthy Aging Awards coming up. Last year, that was an absolute blast to celebrate seniors doing great things in our province. So there's work that we're doing. There's new efforts being pulled together and historical efforts that we think are important to continue, like celebrating seniors who do good work in our province. And I'll provide a bit more information in terms of the member's question posed before shortly.
Thank you, Minister. A gentle reminder to all members to put their questions through the chair, please. Honourable Member for Lakeside.
Thank you, Honorable Chair, and thanks for that reminder. Honorable Chair, the Minister had mentioned earlier that access to personal care home beds are a concern in many regions of our province, with reports of long wait lists and regional disparities. So just wondering, can the Minister provide the number of personal care home beds per capita for each regional health authority? And explain how this budget addresses the current inequities in bed availability across our province.
Thank you, Member. Honorable Minister.
Thank you, Chair. Appreciate the opportunity to talk a bit about personal care homes, personal care home capacity in the regions. So I do want to share with the member, and this was a question that was asked in question period by the member for Tyndall Park actually recently, question around how are decisions made in terms of where personal care homes go. And I reassured the member for Tyndall Park that these are really clinical decisions. And so the Interlake is a great example. So we're building the Lac du Bonny personal care home. I intend myself to maybe put up some drywall or whatever they allow me to put on a hard hat and wear high vis and go there and do. Putting up the sign was not enough for me. I want to go further than that. But the Interlake Eastern Regional Health Authority actually has the fewest, out of all the regions, the fewest personal care home beds based on the population, which for us made very clear that it was important we added more personal care home capacity. And so Lac du Bonny is being built, Arbour is also being built. It's been made clear that clinically, we need to get more capacity in the Interlake in terms of those personal care home beds. The Interlake also, there's a really interesting relationship with the Interlake and Winnipeg in terms of pressures on the system. And so just geographically, proximity, we know that if we can alleviate some of those pressures and make sure that folks' needs are better met in the Interlake, which really we want to make sure everybody's needs are better met in their own communities, that we're going to bring down some of those pressures in Winnipeg, which is really important. And so the evidence and the clinical information really helped guide us to know that establishing more PCHs in the Interlake made good sense, thankfully, right? Because the folks in Lac du Bonny have been advocating for almost 3 decades to have a personal care home there and are really thrilled that they have a government that's finally delivering on that. I think it's also important to note that at committee, we do have a colleague here who made history, if I can just take a moment here to acknowledge, as the first woman to be elected as the MLA for Transcona. Really, really big deal. Really proud that we have these history-making MLAs, women on our team. And what I've heard from the MLA for Transcona is that Park Manor, which is a place where generations of, I think it's, people say Transconians, I want to get that wrong. Generations of Transconians actually, go there and live. I had the pleasure of being at Park Manor and sitting and chatting with folks who were eager to share with me that, their parent had been at Park Manor, that they are now there, they expect their other family members to go there. It was really kind of a remarkable experience and really, really heartwarming and powerful. And it just so happens that Park Manor is also a personal care home that has the largest proportion of multifamily rooms and spaces. Given what we've learned over the last handful of years, COVID taught us that we need to move in a different direction and make sure that we have more single rooms and different structures altogether in terms of long-term care to help people be safe and improve their outcomes. And so our government, again, is taking a clinical approach in terms of looking at the evidence. The evidence is really informing the approach that we're taking, and I hope that provides a little bit of clarity in terms of how the decisions are being made and have been made in terms of the PCH capacity where it is. I stated earlier, and I'll say it again, that I don't know the exact number. It's either 220-something or 250-something personal care home beds were closed by the previous government due to staffing and some other challenges. We've already been able to reopen 45% of those closed beds. We have a target attached to this budget where we want to reopen 80% of those closed beds. Those are beds that just have existed in personal care homes right now, right? But being able to work directly with regional health authorities and with sites to say, what do you need? What have you not been getting that you need from your government in order to be able to successfully reopen those beds? We're also looking at models of care that would allow for us to work with nurse practitioners, to see healthcare aides have enhanced scopes of practice, models that we know are going to improve the healthcare experience and outcomes of residents in personal care homes. We're doing that work of listening to the front lines and enhancing services in PCHs across the province.
Thank you, Minister. Honorable Member for Lakeside.
Thank you, Honorable Chair, and I want to thank the minister for totally not answering that question, but I'll just move on to the next one, seeing as I don't have much time here. Just with the announcements of your new PCH developments, I think it's crucial to Manitobans to understand how public dollars are being allocated and whether those investments reflect cost efficiency and quality care. So what is the estimated cost per new personal care home bed under this year's budget? And how does that compare to previous year's capital and operational expenditures for similar developments?
Thank you, member. Honorable Minister of Health, Seniors and Long-Term Care.
Thank you, Chair, and I thank the member for that question. I thought I did answer the previous question pretty well. I'm sorry that we don't see eye to eye on that point, but I will endeavor to provide more clarity in these responses to the member. So to answer his question about the cost per bed, I do want to make sure that I respect the tendering process. There's a process underway right now to get all the construction and everything lined up in terms of getting these builds fully completed, and I want to honor that process. What I can assure that member is that once the builds are completed, you'll have full, and Manitobans will have full transparency on the cost breakdown. So, we've talked about broadly the costs per build. We've shared that very openly with the public. But what we will do after the fact is certainly provide a full accounting in terms of the dollars attached to that build and how it came together for that member and for all Manitobans. I think that that's a reasonable question for Manitobans to have, and we're happy to provide that after, once the process is, of course, completed. What I will say is that certainly the cost to build personal care homes now is greater than it was during the years that the PCs did not build a personal care home or deliver on the promise of building the Lac du Bonnet personal care home. That would have been a much more affordable project to deliver on years ago. And so we are delivering on that for Manitobans, and we do look forward to providing details around those costs in future when it's completed. I do want to also share with the member some information in terms of what our government is investing in. So in the 24-25 budget, the senior strategy funding was around $12 million. Seniors-related initiatives now in our 25-26 budget are over close to $18 million. So a significant increase in senior-specific initiatives. And I just want to share with the member some of what those initiatives look like. Some are continuing from previously, and some are brand new. So we have let's go up here. We've got the Safe and Healthy Homes Seniors Program, which is helping Manitobans age in their homes safely. It's a process that allows for folks to apply, or their family members can apply for different equipment or items they need to age safely in place in their homes and community. Got the Hearing Aid Grant Program. We have the wonderful Over the Rainbow program through the Rainbow Resource Center, which we are very, very proud to support. The Seniors Guide through United Way. We've got investments in supports for senior elder abuse services. I'm sure we can all agree it's a very important area to invest in. We want to make sure that we're supporting strategies that keep seniors safe and mitigate elder abuse. We've also got investments in Age Friendly Manitoba, A&O services. I know folks are probably very familiar with these folks in our communities. We've expanded age-friendly communities, which is really, really exciting. Lots of rural municipalities really benefit from this initiative. They're doing the work of creating age-friendly communities and really taking that initiative upon themselves. And so we think it's a great idea, it's a great effort, and so we've actually expanded it so that more communities can benefit and get involved. Very, very happy to support the Fédération des Aînés Franco-Manitobains. And I want to say a huge thank you to these folks. The Francophone community has been absolutely wonderful to sit down and have great conversation with and partner with to strengthen services for seniors in the Francophone community. And they've got some really wonderful creative ideas about how we can get that work done in partnership. I want to commend them for their efforts to work with Canada, the federal government, and I sincerely hope that with the newly announced cabinet and the new federal health minister, who I welcome to her role and I cannot wait to sit down and have a conversation with, that they'll continue to have those strong partnerships benefiting the Francophone senior community. There's other initiatives like the Good Neighbors Active Living Center that we're funding, Indigenous Seniors Resource Center, and as I mentioned before, Alzheimer's Society of Manitoba. And so, again, to make very clear, the funding was about $12 million. Now it's almost $18 million in our 25-26 budget. I think the member would agree that our government making more investments into the well-being and lives of seniors is the right approach to take. I'm sure the member would also perhaps agree that building personal care homes and delivering on that is the right approach to take. So we're going to continue to do that good work. I'm always happy to answer questions when it comes to seniors and how we
Order,
can.
please. The hour being 5 p.m. Committee rise.